Good evening, and it's great to be back with you on this Monday night as we begin another night together, another night in this country in the middle of this fight. The president speaking just moments ago, telling Americans to be prepared for this next week to week and a half. The Surgeon General already warning this could be the hardest and saddest week of most Americans' lives, our Pearl Harbor, our 9/11 moment. And tonight, the news coming in now on the British Prime Minister, now moved into intensive care. President Trump saying moments ago Americans are all praying for him. He's been a very good friend. Tonight in this country, the number of deaths now more than 10,000, the staggering toll over just 5 weeks. We are inside a Brooklyn hospital where they say they are taking in a new patient every 14 minutes. One of the lead doctors there saying the entire ER is a hot zone. Inside the temporary hospital at the Javits Convention Center tonight, 2,500 beds, Army doctors now taking in coronavirus patients. We also learned today New York's Governor Andrew Cuomo was going to ask the president for a change with the Navy hospital ship Comfort. And just moments ago, President Trump said he will allow patients with the virus to now be taken there and treated from both New York and New Jersey. We are out across this country tonight, several deadly hotspots, Michigan, Louisiana, Florida, temporary hospitals going up. And of course, the major world headline at this hour, the worsening condition of the British Prime Minister. He has now asked the Foreign Secretary to step in where needed. We will guide you through it all tonight. The statement from 10 Downing Street moments ago, but first the unfolding picture right here in this country, beginning with what we could be seeing in the numbers here in New York. Are we nearing the apex, a plateau of sorts? The governor is cautioning this is still dire, that we are still in the middle of this. And so we begin tonight with ABC's Tom Yamas right here in New York.
Tonight, a look inside the cavernous Javits Convention Center in Manhattan, now the largest hospital in the nation. Teams of military doctors taking in patients, checking temperatures, monitoring ventilators. But New York Governor Andrew Cuomo says even this will not be enough. He's calling for the Navy hospital ship, the Comfort, to start accepting COVID cases. Today, there are only about 40 patients of any kind on the massive ship.
I'm going to call the president this afternoon and ask him to shift the Comfort from non-COVID to COVID.
The Surgeon General says the U.S. is now entering the period we have all been dreading.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives.
In New York State, more than 4,700 have died from the coronavirus.
It's very hard to see the number of deaths we're having. It's frightening, it's disturbing, that amount of loss.
Still today, a glimmer of hope. The death rate here may be slowing. The rigorous social distancing possibly paying off. The governor saying New York is nearing the apex and the curve may be flattening.
Total number of hospitalizations are down. The ICU admissions are down, and the daily intubations are down. Those are all good signs.
But Cuomo also warning,
we get reckless, we change, or we're not compliant on social distancing, you will see those numbers go up again.
But even so, hospitals here are overwhelmed, pushed to capacity and beyond.
Pretty much the entire emergency department's a hot zone at this point.
Dr. John Marshall took ABC News inside Maimonides Hospital in Brooklyn.
I sent out the ventilator update for the morning, but there are 50 right now.
The doctor's team now includes volunteers from as far away as Utah.
We're working on the assumption that almost every patient has corona at this point.
One of the healthcare workers on the front lines, Nurse Rivka Mintz. Her day starts at 5 a.m., managing other nurses and caring for endless patients. Work that stresses the mind, body, and soul.
Has a patient with COVID asked you, am I going to die?
Absolutely. Absolutely, and it's scary. I mean, we don't know the answers.
Across the country, a battle to save lives. This is Dr. Ali Raja in Boston.
Just a couple of days ago, in one 8-hour shift, I intubated 10 patients, which is more than I've ever done in one shift in my entire life.
To Dr. Michael Cuba in New Orleans.
The only mistake we can make as a department in the emergency room or a hospital or a health system in this region is to be underprepared and things to continue to get worse.
New Jersey today reaching a grim milestone, 1,000 deaths.
This is not over and not by a long shot.
ABC's Stephanie Ramos out with EMTs in Teaneck, New Jersey, working around the clock.
This crew just picked up a person who has tested positive for COVID-19. They tell me that person is having some trouble breathing right now. They're taking them to the hospital, but they say they respond to calls like this every couple of minutes throughout the day.
Each case is different. In Iowa City, Irina Yoder brought her 18-year-old son Dmitry to the ER.
I wouldn't let anything happen to my son, so we are fighting right now for him.
Twice they went, and twice Dmitry wasn't admitted. His mother says doctors sent him home, not wanting him to possibly infect other patients.
He is very, very sick right now.
She says he later tested positive, but slowly he got better.
I'm just glad to be recovering finally.
Which is good news. Tom Yamas outside that Brooklyn hospital tonight. And Tom, we all heard New York's governor today when he said he would be calling the president to ask him to allow that Navy hospital ship Comfort to accept coronavirus patients. The president, just moments before we came on the air tonight, telling the American people that he will allow for that change.
That's right, David. We have to remember the Comfort has 1,000 hospital beds. When we checked earlier today, they only had about 40 patients. So Governor Cuomo made it clear they need the help from the Comfort to see COVID-19 patients. We've also learned that the president has approved for patients from New Jersey to go over to the Comfort as well, which is great news for New Jersey. But David, we have to remember the original mission of the Comfort wasn't to see COVID-19 patients. They now have to adapt, like so many on the front lines facing this tough challenge, David.
Tom Yamas, that is tremendous help, though, tonight to learn of the Comfort now involved in this fight against coronavirus. Thanks.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.